everyone. Welcome back to the Speak Up Erika podcast. And I have my friends, I have my, I have, I have my friends, Cruz and T back for our podcast series called Raising Mental Health Awareness. Yay!
Hey,
Hi!
hello.
Hello! I guess we'll do a little refresher about who you two are. T, if you want to share a little bit.
Yeah, so I'm T. I am a creator. I am a mental health advocate, as well as an advocate for the deaf community. What else? I have ADHD and bipolar 1. And yeah, just here to, spark conversation and yeah.
Sick. It's my turn. Okay, I'm Cruz. I'm a freelance photographer, but also a creator of other things. I have BPD, depression, anxiety, and I now have bipolar 2. And yeah, I'm just trying to raise awareness on mental health. And yeah.
Yeah, so important. I love it. Yay. I guess a little bit about our series here. Well, it kind of just says it in the name, raising mental health awareness. That's what we're here trying to do and talk about serious things that people don't really talk about. So today's topic, though, last episode we chatted kind of just an overview, and I think we talked about how you two got diagnosed, right? That's what we were chatting about. But today we're talking about the healthcare system, so we're focusing on that, and how like the diagnosis process.
Yeah, we're just gonna get in there.
Yeah. Got a juicy topic today.
Yeah.
All in all, though, give me one word that explains your take on the healthcare system in Canada. One word.
Complicated?
Good.
Yeah.
T?
I think
I don't know. Stingy?
Oh, I'm gonna take that word too. I think it's a little stingy as well.
Interesting. I'm excited to hear about your experiences.
Of course.
Maybe we'll get into our first question then to kick off the conversation. Yeah.
Of course, yeah. Let's do it.
Okay. So I guess T and Cruz, based on your experience, when should you get diagnosed if for a mental health disorder?
Yeah, I'm hearing this question a lot, especially I'm asking people on IG to just ask me random questions, and this is one of the most common questions that I get, and it's a good question, and I think for the most part, even asking that question is the number one step, because you're kind of acknowledging that you might be feeling something, so you're curious about it. I think for me personally, if you think that you have something, I think that's when you should probably start looking into, your research. And yeah, honestly, if you're curious about anything regarding your mental health, that's when you should get diagnosed for anything.
Yeah, definitely just, doing your own research, stay informed. You know yourself best. So, going and doing your own research, and there's 1,000,001 questionnaires that you can fill out online that can help you kind of narrow down disorders or any other issues. So it's definitely accessible to figure out, what's kind of going on in your life.
Yeah. What about you, Erika?
It's funny because I think in our last episode I was kind of asking this question to you guys in a way, And after that episode that we did together, I actually Googled like mental health assessment, blah, 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 like questionnaire thing that you're talking about, T.
Yeah.
So I didn't end up filling it out because I forgot about it until just right now. I was like, oh yeah, I should probably like finish that off or something.
Yeah.
But, it's funny because I know from before when we were talking about our diagnosis, I haven't personally been diagnosed with anything, but I know that I really wanted to take therapy because up here wasn't just good as it could be, I guess, or I wanted to learn about why I do certain things or act a certain way and stuff like that. But yeah, I think it's good that people are like want to know more about themselves and see if do you think that like if they get diagnosed that they'll be able to really truly understand like themselves in a way? I don't know if that really makes sense, but yeah.
Yes and no.
Yeah.
Yes, because this is really controversial as well. Getting diagnosed and then knowing what disorder you have, and then kind of like, you know, basing everything that you do around this disorder. Sorry, I forgot the question.
It's kind of like of like people kind of it's so touchy, but people abuse their disorder. Like it's like an excuse sometimes. And I've met so many people, it's so shitty to say, but they're like, oh, I did that because I have this. I did that because of this. Like, oh, I'm doing this because of this. Like, yes and no. You know, it's so complicated.
Yeah, and it's like situational based too, I guess, depending on the person, right? Yeah. I think even someone I know right now has been diagnosed with anxiety disorder, and I feel like they weren't being considerate of the people helping them out, but then they would kind of base it because they have this disorder, as you were just talking about right now, blaming it on maybe I don't want to say like being a shitty person, but just like everyone's going through things, and like you kind of have to not be an asshole just because you have certain things.
I definitely feel like it goes like it's a two-way street, right? It's like there are pros and cons of getting diagnosed and like self-diagnosis, which is one of the topics. But in terms of getting actually diagnosed by a physician or whatever, people get so into their heads and like they end up becoming what their disorder is.
Interesting. I mean? Okay. Kind of like you know, when you do a Google search of you have like back pain and you find out it's cancer or something like that.
Something like that. Yeah. I mean, I know myself. It's for me, I do get into my head a lot because I know what BPD is, and it's so hard to not become what your diagnosis is. Like I know T always reminds me like you're not what you're diagnosed with and all that stuff. Like she reminds me all the time, and you know, it's hard. It is scary getting diagnosed, but I think it's so important to never stop like being curious about who you are and what you go through, because your diagnosis could also change, right? Because when I got reassessed, I actually had asked the psychologist, like, is it stupid for me to continue my journey on trying to get assessed for more things? And he was like, I'm not going to say yes, I'm not going to say no. And he said, I think it's good that you're curious, because if we never had that second assessment, then we wouldn't have known that your depression is bipolar depression. It's not unipolar, right? So I think like a lot changes in a span of how many months. So I think you should keep learning about yourself.
Exactly. About how much changes in a day.
True.
Right.
So.
Yeah.
Very true.
What is the difference between unilateral and the other depression that you were just saying?
It's just unipolar and bipolar. So like unipolar is like depression is like prevalent for most of the times, you know what I mean?
Okay, gotcha.
But with my depression, it goes up and down in waves, like almost constant.
Okay, gotcha.
Yeah. So I could at least gauge when my high is and when my low is.
Okay.
Yeah.
And I guess in terms of of getting diagnosed, is it possible that when you get reassessed that, like, is it possible it can go away? I don't know if that's a stupid question. Like, could your bipolar go away, or would it just like you just don't experience those symptoms as much? And yeah, I guess that's my question. I don't know if that makes sense. I'm sorry.
I don't know if that makes sense. T, do you know? Trying to like.
I guess like in a comparison, this is the only thing I can think of. Like in a comparison, maybe if you have like, I don't know if this is a bad way to, like, if you have a cold and like, your symptoms go away and then you don't have a cold anymore. I don't know if that really, I don't know if that's really a good comparison at all, though.
I guess kind of. Yeah. Like we were saying, things change all the time.
Right, yeah.
They're constantly changing as people, as humans. So it is very possible that, you know, you could have been, let's say, depressed for however many years, and you're working on that progress to, you know, get out of that hole. It's very possible that you won't be depressed, you know.
True. I think like specifically if you're basing it on like your experiences, like you had a traumatic experience and time goes on, and I think that's what T's trying to say, right? Like you'll eventually
I'm gonna think of it like a phase almost.
But like it's not a phase.
Yeah.
Yeah.
It's like I get what you mean though.
Yeah.
I think, well, for someone, say for example, if you have an anxiety disorder, are you able to convert it to just being someone who's anxious rather than a disorder, and like having it like control your life? That's like a possibility.
Yeah, I mean, you know, therapy.
Right.
If you're open to medication, definitely.
Right.
Like,
yeah.
My psychiatrist actually recommended lithium for bipolar, and it's a different medication. So I'm actually weaning off of my antidepressants because I don't need it anymore.
Okay. Yeah.
Now that we know that it's bipolar.
Okay. Gotcha. Yeah.
So it's different medication for that, right? Okay. So yeah, definitely. I think things could change, but it's very situational and dependent on the person.
Yeah, for
That's
sure.
A good question, actually.
Yeah, I was like, oh my God, does this make sense? And I didn't want to compare it. Like, I didn't know how to phrase it properly. Yeah, I think like one of the therapies I did was like a trauma therapy.
Trauma therapy.
So yeah, so it's if you've experienced like you saw someone dying or sexual assault and stuff like that, and they do the CBT, cognitive behavior therapy, and try to change how you look at the situation, and like they go through like blame. So if you're blaming someone because this happened, or you're blaming yourself that it happened, type of thing, and they kind of tell you the truth or help you see like that's not actually true.
It's like altering your perspective.
Yeah.
Interesting.
It's really interesting. I think it did help a lot because I feel like for myself, for my sexual assault, like certain things, like certain places I would avoid, or certain people, or like you have this view of the world like maybe all people are bad, or I don't know. I'm just like throwing that, spitballing it, but then it kind of helps you see that no, that's not true, and then you're able to like go to these places or do certain things.
Wow, so, that's cool.
Yeah,
that's almost like DBT as well, but it's mostly like how to shift your thoughts, basically. Yeah.
What do they do exactly again for DBT? And what does the D stand for again?
Dialectical. So it's like, I think like two separate sentences could also be true at the same time.
Right.
I forgot. I think I mentioned that last time. Yeah.
Yeah.
But basically, yeah, it's like they teach you how to unhook from your thoughts.
So T, I know you mentioned about like taking the questionnaires before, about trying to get self-diagnosed that way. Oh, I guess Cruz and T, if you can both kind of jump in on it, of how do you go about getting diagnosed?
Yeah. T, you want to
go? Sure. So again, going through questionnaires, doing the research for, whatever disorder you may think you have. And also, after going through all of that and after doing all of your research, looking at the DSM-5, which basically outlines every disorder in psychology. So they go through everything and tell you the distinct traits and symptoms that go along with each disorder. So it's really informative and kind of just gives you a better outlook on each disorder. But again, with that, you might not necessarily have everything that disorder accounts for, which is okay. And you can still totally have that disorder. Like there's varying severities. So yeah, that would be my.
What's DSM stand for?
I don't even remember.
So basically DSM, it's like a series of tests. They had 1, 2, 3, 4, and they're creating a 6th one, right?
The DSM is a book.
So. Yeah. But like they had different different series of
Diagnostic and Statistical Manual of Mental Disorders.
Yeah, there we go.
Google.
Nice.
Look, it's just a book that outlines all of the disorders, and it's been updated, kind of regularly. So we're in the 5th edition right now. And there is talk about a 6th edition, which should possibly be coming out this year. And with each update of the DSM, they, tweak things about each disorder or get rid of disorders altogether. So yeah, it's very, very analytical.
Even that, like it shows that even the DSM is being updated, just like how everything about us changes. You know what I mean? Like
that's so funny.
It gives them more research because they only know so much. Right? If you think about it, the DSM, it started with, how did it start with? I think there was like a section about like gay people and how they were, what was it, T?
It was just like previous DSMs were, like very wild ideas, and also psychology was heavily influenced by like the church as well. So some of the disorders they had were like I don't know names, but it was like, oh, if you think your sexual orientation is other than what you actually are, then it's like
you're sick or something like that. Yeah,
you gotta drill a hole in your brain type stuff.
Have you watched Ratchet on Netflix?
Yeah,
they were that, I think that's based in like the 70s or something, but they were doing the lobotomies on lesbians, right?
Yeah, so that's basically
that's what it talks. It's crazy that like the way they thought of things before, and
of course, drastically changed,
and it not long ago,
right?
70s. Like shit.
It's kind of scary.
But yeah, I don't want to like trail off too far away, but like for me at least, I think getting like self-diagnosing yourself isn't obviously like the end of everything. Like you should go to a family doctor or any doctor that you can and tell them about like the symptoms that you're feeling or anything, and then from there your family doctor could refer you to a psychiatrist. They usually refer you to CAMH. But there is a gap that I want to mention, is that like unless you actually fucking say that you're gonna hurt someone or you're feeling suicidal and you're gonna harm someone, then like they won't really take it seriously, right? Unless you're like super in need of an assessment, then you're gonna have to wait,
like mental breakdown kind of thing. Wow, interesting.
But I guess we could like talk about that after
for sure. I know we have some notes that we wanted to talk about I have like the CAMH notes here, and
Yeah.
we're gonna be chatting about what's wrong with the Canadians' mental health care system. Going back to the self-diagnosis and stuff, can you chat about like the pros and cons of it?
Yeah, so like, you know, you're doing introspection, you're getting to know yourself a little bit better, which is great. And then we talked about the cons of, you know, attaching yourself to that disorder and using it as a label, as an excuse at times. Yeah.
Because there's so much overlap between different disorders, like getting self-diagnosed is like you could only know so much. Like you could even misdiagnose yourself so easily.
Yeah, exactly. So I mean, it's a good thing to do your research and understand, but also then seeing a doctor and, you know, I guess confirming or yeah, just.
And I think it's so important. I think I mentioned this before. I think I mentioned it in the other podcast, is that when you do visit a doctor or a psychiatrist, it's important to tell them literally every single thing that you're feeling. Because again, like T said, only you know yourself and only you know what you're going through. And giving them the wrong information or omitting information could lead them to misdiagnosing you.
Right.
You know, so it's definitely like a two-way street, like help them help you type of shit.
That's interesting because I feel like sometimes people have a hard time about speaking up about how they feel, right? Or what they're thinking, and they don't really understand or how to tell other people about it too. So that's difficult, eh?
Yeah, like when I went to my family doctor for the first time, man, I fucking bawled my eyes out. And I was like, I'm so sorry. Like, I don't know what to do. She's like, no, it's okay. Like, tell me everything. Like, it's important to tell them literally everything.
Yeah.
Which is why which is another reason why I recommend a family doctor.
Right.
Because you know your family doctor, they know you. They're not going to disclose anything. I was like begging my family doctor not to tell my mom. And she was like, I'm literally not going to. Like, I can't.
She's not allowed to, yeah.
Yeah. So
yeah. I know that's awesome that you have like a family doctor that's able to help out. And then like I feel like I've talked to friends and they're like, yeah, my family doctor's shit, like I need a new one, you know. Your experience with your family doctor?
Yeah, I mean, you know, my family doctor's just been around forever, but it can be like dismissive and not great. But
I do prefer female doctors.
I don't think I've had a male. Well, I had just literally one family doctor for my whole life. So yeah. Sorry, when I think about my family doctor when I was like a kid, this is like a really weird random situation, but I remember like my vajayjay was itchy. And I was a kid and I scratched it and I bled and my mom brought me to the doctor because she thought maybe I was having my period or something.
Yeah.
But I actually just scratched my vajayjay. And I remember waking up in the doctor's office, like on the bed table thing, like lying down and open my eyes and my doctor just looking at my vajayjay. And I was like, okay, what's happening? And I just went back to sleep.
You went back to sleep?
Yeah, I either went back to sleep or my memory was just like, no, this is gonna get erased. Like I don't want to remember this anymore.
Erika.
Sorry, I digress of like my vajayjay bleeding doctor story. I think I was like 5 or something like that.
Okay, so that's young.
I was really young. Yeah.
You're so funny. Oh man.
So next question. I guess. Well, talking about the misdiagnosis part, were you ever diagnosed, T or Cruz?
Like misdiagnosed?
Yeah.
I wouldn't say I was misdiagnosed. It was just like they didn't finish it.
Oh.
Right. So I kind of, the whole time between June until now, I'm like, do I have bipolar? Like, what the fuck is going on? So I wouldn't say misdiagnosed. It's just like I didn't get the full answer and I had to wait so long. But I've met some people that were misdiagnosed. People got misdiagnosed with BPD, but they actually have bipolar. And there's a huge overlap between the two. And apparently, if you're female, then it's more, you have a higher chance. You have a higher chance of getting misdiagnosed with BPD or something. It's vice versa. Yeah.
Is it like hormones or something? Like what is the reason?
Because like it's kind of, they take into consideration your emotional state.
Okay.
With BPD, it's very like emotional. So I think that's why it's so difficult when they diagnose females. And again, these doctors are so quick to diagnose you. And you're just like, what the fuck? Like, ask me more questions and shit like that. So it's like, are you sure? Like, that's what I was doing when I got diagnosed in June or whatever. I was like, so is it BPD? Like, is it bipolar?
Because like you should always, question.
True.
100%, yeah.
Very true.
I mean, at the end of the day, yes, they are healthcare professionals, but again, you know yourself best. So
yeah. 100%. Yeah.
Yourself, T? Yeah.
I wouldn't say like misdiagnosed. Again, just like going through assessments and I guess having stuff just kind of up in the air. Yeah, no, not misdiagnosed though.
What is the reason why it takes so long? But I know you said it took like 6, 7, 8 months or whatever, right?
Yeah.
To get all the information.
We don't have resources. We don't have enough people with that capacity of people wondering, like, what do I have and all that stuff. That's why there's such a huge wait time. And there's actually like a note that I put under here is wait times for counseling and therapy can be long, especially for children and youth. In Ontario, wait times of 6 months to 1 year are common.
Wow.
So
that's crazy.
Important. While mental illness accounts for 10% of the burden of disease in Ontario, it receives just 7% of healthcare dollars. Relative to this burden, mental health care in Ontario is underfunded by 1.5 billion. That's fucked.
That's actually crazy. And this is just a stat for just Ontario too, right?
Yeah, this is from CAMH.
Wow.
And, there's not enough resources. There's not enough people out here to deal with that stuff.
Yeah.
And yeah, I mean, like, again, like why I pointed out that unless you're actually a threat to yourself or others, you won't get the type of,
you're not going to get that immediate
attention
or help that you need.
Yeah.
I heard a stat the other day about the States, and it was comparing the number of therapists to people. And it was like one therapist for like 70,000 people.
Shut the fuck up. Oh my God, dude.
Yeah.
Same. Like,
that's crazy. I can't even, yeah. I did an episode with my friend who's in the States and she was talking about her mental health and like it's just crazy how, because they don't have, I think we have some coverage under OHIP for certain things, right? And we have like if you're employed, you have EAP and they've released like some of the free online therapies and stuff. So we have some type of support, but in comparison to the States, it's just like shit show for them. Yeah. Oh man. Do you think, I mean, going back to defunding the police and all of that and like using those dollars on like better mental health care and like for the homeless and all that kind of stuff, do you think that sometime in the future that there's the possibility we're going to have more funding for mental health? And I mean, I would like to think yes, because there's more awareness and stuff being done, but I don't know your opinions.
I hope, but I think it's gonna take years.
Yeah.
I think it's gonna take way longer, especially with the shit that's happening now. And like,
With
fuck,
COVID,
man, like even with them having an issue with the dude creating those tiny shelters, like what the fuck? Like that's so backwards.
Yeah.
Right?
It's true.
So even seeing that, it's gonna take fucking years.
Yeah, it's really difficult to gauge that, because although awareness is increasing and we're doing these chats and we're having these conversations, which is fucking great. At the end of the day, it's really hard to change things systematically. So it's a matter of time.
I mean, I had this conversation with someone when like the whole Black Lives Matter was happening, and I was talking about like how can we truly make like change and shifts, and it's just by like the people who are in power cannot be in power anymore. Like we have to have different people in power making new decisions and actually like changing things, right? But I think my friend was saying something like, if those people are gone, then everything will be okay, kind of thing. Like if those, like say if all the racists were gone, then everything would be okay. But I think it's also like if your parent is a racist and you're a racist, so we still have that, like their kin is still here, you know? So it's like even if those people die, there's still going to be people around who have same values or things about stuff like 100%. This, right? So I don't know if it will, like I don't know if like the whole power thing will ever truly be dismantled. I guess maybe they will all just die, but I don't know if things will actually change. Like I don't know.
No, that's so true though.
Or like saying, oh, maybe if the world ends, things will be okay. But I think if the world ends, like we'll have the caveman and we'll do this again, then we'll be people again and have this the racism.
History repeats itself, bro. History repeats itself.
Yeah, so even if the world ends, I feel like in a million years it may come back to be the exact same where we are right now. My perspective, I don't know. My theories.
No, like I agree, but it's so pessimist to think that way. But I think it's so fucking true, because man, like humanity fucking sucks, man. But you know, there are good people, and
there are good people.
Man, I don't really know. Like, I do hope that something changes, because even speaking to therapists and all that and hearing their point of view, like they feel the same way, that our mental health care system is fucked. And it sucks that, like, you know, like we're trying our best as civilians, whatever,
right,
to make a change
in society.
Yes, people of society. But yeah, I think we also do need help from people in power. Different people.
Definitely.
Yeah.
But you know what? Change starts with just one person. So
yeah. I know. You're right, T.
Who me? Just kidding.
So, Cruz and T, do you think when you got diagnosed with your mental disorders that people treated you differently?
100%. And I would feel I feel that like my family would kind of treat me differently, not in a negative way, but more so like they're so worrisome, and I don't blame them. It's just like it kind of changed the dynamic, because now I feel that pressure into like kind of letting them know that I'm okay. And it's like a lot of reassurance, and I don't need that shit really. But I do feel like I've also been treated differently by friends. Kind of like, I think some of them kind of distance away from me, which is completely fine. It's okay, because it is a lot. But 100%, I feel like some people treated me differently after saying, you know, my mental health stuff.
Because you just moved back at home too, right? So it's that like changed as well. Were you diagnosed when you were living away from home? Then you came home and you like told them, or how did?
So I got diagnosed 3 times.
Right.
Okay. First one, I was living in Mississauga, Second one, I was living in Toronto, and then third one was just recently.
Yeah.
But you know, like, it's family, they're gonna worry regardless, but it wasn't really negative in a sense. It's just that they have more questions and concerns, and yeah, they do kind of like treat me a little softer. But yeah.
Yeah, interesting. Yeah. For yourself, T, any treatment, different treatment?
Yes and no. I mean, my family only knows that I have ADHD, so I haven't told them yet that I have bipolar as well. But I feel like people are really like taken aback when I tell them about my mental disorders, because it's kind of like, oh wow, like
You
wow,
got
like
that?
really open about it. So I mean, I get good feedback, and I also get,
there's like weird feedback, like, oh, you don't look the type. I'm like, the fuck?
Well,
what do they look like?
Like, what is your stereotypical person with ADHD look like, or someone with BPD look like? Like, it could be anyone.
Yeah, for real. I saw a meme. I saw a meme. It was like, oh no, you look too, or like, you're too cute to have depression or something. I'm like, that's funny. Like,
ew.
Yeah. People actually say that though. Like, they're very ignorant.
Yeah.
I remember when I was like 17 that I was telling my friend about like my suicidal thoughts and stuff like that, and like I guess depressive symptoms or episodes. And he's like, "Oh, you experienced that? Like, you're Erica though. Like, your life is good, you know?" And it's just like, yeah, but it's funny because like what you said, T, like, you're the only one who knows yourself. It's like, yeah, sure, you can see me as this kind of person and that's your perspective of me, but you don't actually know what I'm going through up in here, or like in like my feelings, I guess, and stuff like that. So
it's kind of like, obviously we come from families that are not, you know, I mean, they're kind of traditional in a sense. And even like your parents are like, what, you have this, you have that, all of that, like, you shouldn't, like, go exercise, you'll be fine. Like, get some dopamine up or some shit, you know. So it's kind of like that.
yeah, Cruz, you're talking about like, I guess, our families. And T, I'm not sure if your parents are immigrants as well.
Well, my dad is. My dad's Trini, and my mom's Canadian, so she was born here. But just like I mean, both of their views are very, I want to say, uneducated, because mental health is very uneducated. Like, people do not know a lot about mental health. We're not taught in school. So yeah, I want to say that they're just very uneducated, and I don't know, maybe due to culture, my dad's just very like insensitive. And like, oh, just brush it off, like,
yeah, dismissive about it.
Yeah, dismissive and yeah, insensitive, I want to say.
Yeah, I think I mean, my family's not like that, you know. Like, it's been a couple of years now that I've been dealing with this stuff, and they've been very how do I say this? They're learning, and they're trying as hard as they can, and I do appreciate that. But I think because it's such a touchy subject in their eyes, I think they're like scared to ask questions. And I think, like, even my siblings, I think it's good to be curious on the other end. Like, if you don't know something, just ask. And I'm not the type of person to just like blurt it out, like, here, this is how you deal with someone who has this and that, whatever. I think it would, again, two-way street. It would help you if you just ask questions. Because there is like kind of a disconnect that I've seen between my siblings and I, because now that I'm dealing with this stuff, they're kind of older as well, like, and I know they're scared, and because they don't really know exactly what it is, but I think they need to ask more questions.
I know in your podcast, the Creating Strong Ties, I think it was like the last one or the one before that, you and Ron were talking about ways that like friends and family can help and what they can do for people who have like the disorders. That was awesome.
Yeah, just ask.
Yeah.
Be curious, you know.
Yeah.
I think maybe part of it is being curious and asking, but not being disrespectful.
Yes.
That may be part of it, right? Sure. Like they're like, oh, so what is wrong with you, kind of thing. And it's like, no, that's not the right way to ask it, right?
That's so true though. That's very true.
So you don't know how to say it maybe. But it's like, where are the resources to ask appropriately, I guess. Like, can you just, I guess they could Google search and be like, how to ask a family member, and Google.
I think the main tip is to go at it with no judgment, because a lot of people already have their biased opinion on something, you know. Just listen. I think that's the biggest tip that I could give anyone.
I guess maybe.
Oh, sorry, no, Erica, I have a question. Like, when you like talked about your suicidal thoughts with your friends, like when you were younger or even now, like, do you scare people off?
I don't know. I think it goes two ways. I think they can resonate because they feel the same way, and then we kind of build a better bond and we can talk about it, and it gives them. I know one of my friends, Mango, she like when I opened up to her about it, she was able to feel comfortable in talking about her personal experiences and felt that she had someone to talk to about those things. So I think it definitely goes two different ways. And my friend who I told when I was like 17 about that, he was feeling the same things. So he was like, oh, like he has like a heart problem or something like that, and he's like, oh well, like you have a lot of things to be grateful for kind of thing. So I don't know, I guess it kind of goes both ways. I'm trying to think if there's someone that I like scared off, but I can't really pinpoint one. So I think most of the time when I would like post on social media about mental health stuff or like that I'm going through shit, but like it's gonna be okay, it's interesting because a lot of people actually reach out and saying thanks for posting this, because there's people are just going through it, I think, and maybe in their Instagram circles or people that they follow or whatever type of media they see, they don't see people doing that thing. I don't know if I answered that. Okay.
No, you did. You did.
Nice. Do you feel the same way, or do you
I mean, like, people off? I kind of like, I think it was like a lesson learned is that I tend to not disclose a lot of information unless people ask.
Fair. Okay. Yeah.
So like when I did, I think there was like a friend group a couple years ago, and we were just hanging out, and I was like in my lowest state, and I kind of they asked me like, what's up, and then I said it, and we kind of like stopped talking after that night. So I think I did scare some people off, which is completely fine, but that was like a lesson learned, is that
be careful who you say things to.
Exactly. And it sucks that it has to be that way, but at the same time, like, again, I'm not the type of person to be so open unless someone asks me, right? So it is definitely, it is hard to even having to like process that information when you're hearing it from a friend, right? So
even just like saying how you're feeling, like you can have 1,000,001 thoughts racing in your head, and it's really easy to get stuck in that and have that continuously looping in your head. But to actually verbally say the things that are going on inside your head is extremely difficult. So
I feel that's the scariest part, I feel, too, because when I first talked to my therapist and having to say like what you feel and think, I feel like I always cry whenever I do that.
I've actually gotten better.
Yeah.
Because
What is a tip that has made you better
it's not even a tip. It's the fact that I've been bouncing around to different psychiatrists and different people to assess me and all that stuff. I'm just like, fuck, I've done it so many times now that, you know, I've been repeating myself an X amount of times. I'm not crying anymore, but you know, like I still cry sometimes to my therapist, but it's just, I think, okay, I guess a tip is actually physically saying it repeatedly and accepting, I think accepting. Number one is acceptance of those feelings. Because you know, I noticed that there was an ounce of shame and guilt when I'd be saying it out loud.
Right.
Which is the reasons like why I cry, but it's gotten better. Yeah.
Yeah, awesome. I'm proud of you.
Thanks. Proud of you. You too, T.
So much love.
Yeah, I know. So, yeah. Cruz and T, can you share any negative experience you've had with the healthcare system?
Yeah. I mean, I think I kind of mentioned it, you know, throughout this podcast. Is my main concern and issue is just the way that they go about, I guess, assessing people to begin with, and the wait times are just so long. And my biggest issue is that why do I have to tell a doctor or whoever, a psychiatrist, psychologist, that I'm going to harm myself or I'm going to harm others in order to get immediate help? Why is that a thing? Because I think I mentioned it in the other podcast too. I can't remember, but I was comparing myself to a friend that I knew over the summer. I was going through shit. They were going through shit as well. And they were able to get free therapy in a fucking snap because they physically said, they physically went to CAMH, right? They said their shit, you know, suicidal thoughts and all that stuff. And because I was communicating with that friend as well, I was, you know, I could say that we were feeling the same thing, but I was a little more, I guess I didn't say to my doctor or therapist that, yes, I'm going to harm myself, but I am thinking of it because they went to CAMH and said all that stuff. They were able to get all this accessible treatment, all that stuff immediately. Whereas I had to wait about a month to get assessed over video by CAMH and all that stuff. And this whole summer, I was bouncing back and forth, trying to get an answer or even trying to find affordable therapy services. It was only like about a month ago was when I finally got accepted by Stella's Place to get free therapy sessions. And it also took a couple months to get into a DBT group therapy. And I think all in all, what I'm trying to say is just the wait time is fucking excessive. And I think that's a huge gap in the healthcare system.
Yeah. And it sucks because, like, you know, there's two sides to it. Obviously, they want to give their attention to, you know, the people who have suicidal thoughts and feelings and actions. So, you know, they're going to try to put their attention towards those people. But it sucks because just because these people are voicing it doesn't mean this whole other group of people aren't feeling the exact same way. It's hard because then they're kind of like, okay, well, who do we prioritize, you know? So yeah, it's really difficult.
Just like we were saying, how difficult it is to even say it out loud. You know what I mean? Like for me personally, I can't, it's fucking hard to say that shit. So I guess like they're kind of, I don't know, like, I guess if you're more outspoken, you can get that shit, right? But then they leave people like us behind.
It's interesting the way that I'm trying to find like, I guess a comparison is if someone was to go to the hospital, they're going to help the person who's bleeding because they can like physically see it rather than the person who's like maybe low-key has like a bursted artery or something and they can't physically see that,
right.
You know? I don't know.
Dude.
Like in terms of prioritization, I guess that's like a comparison that like, in the healthcare system. Interesting. Yeah. I guess for myself, the last time, I don't know if it's necessarily negative, but when I was overworking myself, I got really sick. So I had a fever and my face, I don't know why this happens, but sometimes I get this like face like rash, and like my eyes swell and my whole face swells, and my whole face is just red. So I still don't know the reason for it, but all these things were happening to me, and I didn't know why it was happening. So I kept seeing doctors. Like I kept going to the walk-in clinic, and they're like, "Oh no, you have this," or "Oh no, you have that." And I was like, "Okay, but doesn't explain why this is happening to me." So I think I went like 3 times, and I didn't really get like a good answer. So then I ended up, my coworkers told me, go to the hospital, like they'll help you there.
Fuck yeah.
I was like, okay, like let me go to the hospital. So I went to the hospital, and then like to me, I guess it, like I wasn't bleeding or anything, like it wasn't like apparent physically. So the doctor, it's nice because I had pictures of myself from when like my face was all fucked up.
Yeah.
So from those pictures is why the doctor helped me and was like, okay, well, yeah, that's not normal. And then he ended up bringing me to a allergy doctor. And then the allergy doctor kept taking blood tests and kept taking everything. Long story short, they don't know what's wrong. They didn't know what was wrong.
Man.
So I went through everything, and the allergy doctor found out I was allergic to like pine trees or something like that, but it wasn't pine tree season, so that's why she kept doing blood tests and testing for all these other things. At the end, she just found out that I had low white blood cells, which could possibly be why I was getting sick and experiencing weird things. But
all in all, all in all, like without you having to go through those extra steps, like they wouldn't have done those tests on you. You know what I mean? Like that's so
exactly. Like you have to push. You really have to push for like help. Yeah, which is like mine isn't related to mental health in that sense, but it's weird. It's not. I don't know.
Yeah, it's just the healthcare system in general is just so fuck.
Yeah.
T, do you have any
it's
stories?
Like trial and error.
Right.
Yeah, so as I mentioned, my family doctor is a male. He's like, you know, your typical cis white male. He's just kind of condescending, and yeah, so that's my doctor. So I was having abdominal pain for, you know, a while, and I was like, this is not right, like this feels weird, this is off, I need to like figure out what's going on. So I went to the doctor, and he was like, oh, like I'm sure you're fine, you know, he like poked around my abdomen and was like, does this hurt, da da da, and I was like, yeah. He was like, okay, well, I don't know what's wrong with you, I think you're fine. And I was like, well, I'm telling you I'm not, but okay. So he was just, yeah, very dismissive, and I was like, okay, well, I'm still in pain. So I decided to go to a walk-in. So I went to the walk-in, and they were like, okay, maybe you should do, you know, like a pap test, you can do an ultrasound, you can do this, you can do that. I went through a shit ton of testing, and this was over a few months. So I was still in pain, like just not knowing what was happening and why this was happening. And yeah, it just sucked because I was just kind of being thrown around to different doctors, like, here, I'll refer you here, try this, I'll refer you here, and see if they do a better job type thing.
Backwards.
Yeah, and it sucked because it took so long
to get the help you needed.
Yeah, and it was just very
frustrating.
Yeah, very frustrating as well.
It's because we're like, sorry, I just want to chime in. It's like we're putting all our trust in like these doctors to like refer us to other people, but like, what the fuck?
Yeah. And another thing too is just like they're very quick to try to prescribe medication. Like, I ended up going back to my family doctor, and he was like, oh, well, if you're in pain, like, do you want pain meds? And I was like, no, like, not really.
Yeah.
Help me, you know? So yeah, that was a really frustrating time. I ended up figuring out like what happened and what my issues were.
Yeah.
But yeah, it was just really annoying. It took so long.
My God, Jesus. Yeah, even when last year when I like fucked up my Achilles, I was going back and forth to the fracture clinic downtown, right? And I had to push. I was like, I want a surgery. I want a surgery. Like, tell me what's going on. And I think it got to the point where I annoyed them so much was when the doctor literally referred me to another doctor in another building, a specialized doctor. So I got better treatment there. So if I hadn't pushed myself and was annoying to that fucking doctor, then I wouldn't have gone to like Dr. Lee or some shit.
You know?
And like, what the fuck? You know what I mean? I should have gone to that doctor in the first place because he specializes in injuries like that. Why am I going to the fracture clinic for that shit? You know what I mean? It's so
yeah. I think a story that like comes to my head when we talk about like the frustration of the healthcare system and not getting access soon is we've talked about this kind of before, is like John Rivers' story. And I guess for people who's listening and doesn't know about John River, I don't have all the details, but you should definitely look him up and check out his story. But from my understanding, he was going through pain in his head, I think, in his brain or somewhere around there, and he kept going to the doctors asking for help and saying like, so this is wrong, and I need to find out what's wrong with me, and they just kept pushing it off and saying like nothing's wrong, which is kind of, I guess, what all of us have kind of experienced, just like getting pushback from the doctor. Until the only way he got help was because he had a lot of followers on Instagram, kind of thing. Like he had people kind of advocating for him, and like I don't know if it was like reaching out to the news or something like that, but there was just people advocating for him. So he was able to get that treatment that he needed, and it turned out to be like a really serious problem that he had.
But it was months, right? Like he was hospitalized for so long, and like they still didn't know what was wrong with him.
Right? Yeah, you going back to what you were saying, right? Right, Cruz, was that the time it just takes so long.
Yeah, dude, it's
for
so
everything.
sad. Like, yeah, I don't know. I mean, there are resources that you could reach out to, like CAMH is there and all that stuff, but damn, like again, if you're not in like immediate,
bleeding,
if you're not bleeding, then you're not going to get the help that you need, and it sucks.
Yeah, and even when you take into account like all the intersectionalities of being a woman or a person of color, and having, like, for me, my white male dominant doctor, it's just there's clash.
Lots of holes definitely in the system.
And even just like I guess the costs of getting certain help is fucked up. Like I'm grateful enough to have been able to find this DBT group that is super, super cheap. But then again, they only accept a certain amount of people, and it's only by referral, right?
Yeah.
I had to push my doctor to refer me. And even then I had to push. Like, you gotta push.
Yeah, I know. Do you have information on like how much our OHIP covers based on your experience, or do you know?
In terms of like OHIP and the benefits that I get from my work, because I work full time.
Right. Yeah.
I just know OHIP for medical stuff. For medicine. I think if you're under 25, it's still covered.
Right.
I don't know what else does OHIP cover. I found out the other day by T that you have to pay to get assessed.
Well, okay, no. So yes and no.
Okay.
So you can go to your family doctor to get assessed. For me personally, I don't like my family doctor. I didn't want to go to him to be assessed. I did go to him to be assessed for my ADHD. But when it came to, digging deeper, I wanted to go to obviously somebody who's specialized, so a psychiatrist. So if you're going under OHIP, go to your family doctor, or even a walk-in can refer you.
Yep.
And going by referral, that should be covered under OHIP. In terms of therapy, though, I know that you'll probably have to pay for therapy. It honestly depends where you're going and whatnot, but I don't think OHIP covers therapy other than the free Ontario-wide CBT.
I know I was doing an episode with my other friend who does group therapy, and she said you can go to the hospital and they have some free resources there for you. So that's I don't know the details, but yeah, apparently that's a way that you can get some help that's affordable or free.
Yeah.
Yeah.
There are a lot of resources. It's just you have to do your research. You have to do your due diligence on that shit because it's a lot. Even in Toronto, there's a few free therapy places, like Stella's Place is what I'm doing. Friends of Ruby, which is only for LGBTQ whatever. But again, for free therapy, you're gonna have to wait at least a year, 6 months to a year to get free therapy, and then again, it's only a certain amount of sessions, right? But there are also things like, what was it, Mind Beacon?
Yeah, Mind Beacon, Ability. Those are the two that I took for free therapy.
Yeah.
So it is out there.
Yeah.
It's just.
Yeah, we'll definitely share what we have for resources in the podcast notes. So at least we can, if people who are listening are looking for something that's affordable or free, we can kind of have that there for them.
Yeah.
But
why can't shit be free? Not therapy, come on.
Right. I know, for example, education, for us, our education isn't as expensive as the States, but then in Netherlands, I don't know where it is, Europe or something, their education is free for post-secondary.
It's right? It's like one of those Swedish or Norway or something like that. Could be wrong.
So I wonder of what are they doing over there to get free I guess essentials that we can be doing here.
The thing is because we're North America, it's all about business, right? It's all about corporation and all that stuff. In Europe, I don't think they're so pressed on their values are so different than ours.
Right.
They care about their people. They have four-day weeks for work days, right? They only work 4 days a week.
Wow.
Right here, it's just all about the money.
Yeah, you're right. It's ingrained in the culture and the values, I guess. It sucks, but I wanted to just say thank you so much, Cruz and T, for being part of this podcast and wanting to do this series with me. This is our second one so far, so it's been really awesome to just be able to, for myself, to learn about it. And it's such an important topic that we really need to discuss about. So thank you so much for being here with me and sharing your time and energy.
Thanks for having us, Erika. Thanks for opening up the space for everyone.
Yay. I know before, when we ended off the episode, you shared about how we can support your projects and creative stuff that you're working on. Would you want to share a bit about that as well before we end off?
Yeah. Talisa?
Yeah, I'll go ahead. Probably just following and keeping up with me on Insta. My Insta is at it's BBT ITS BBTEA. I model, I act. What else? Any of my art that I want to sell, I usually post on there. Yeah.
Sick. Yeah, you could find me on Instagram, VMYVC. Check out my art. We're also selling stuff there. And I'm also doing a separate podcast with my cousin Ron. It's called Creating Strong Ties. You can find us on Apple, Deezer, Spotify. It's the Strong Ties podcast. So we're also talking about mental health stuff there as well. Yeah, check it out.
Yes, love it all. Yeah, I'm a huge fan of the podcast. I feel like I keep like commenting on every video, and I don't know if it's annoying or not, but I'm just like, no, yeah, whatever.
Please comment. Please comment.
I see T on the comments too. I should be like, hey T, what's up?
Thank you guys. Love the support.
For the next episode, we're going to be talking about therapy, some stigmas behind it, what we've been going through and stuff. So that will be coming out in a couple of weeks, and we'll chat then.
Yay, yeah! Excited.
Thank you for listening. Bye, everyone.
Thank you.
Yay. Bye.